Welcome back, students, to part 3 of psychological disorders. We now move on to dissociative disorders. Dissociative disorders are a group of psychological disorders in which there is a disruption in the normal integration of consciousness, memory, identity, emotion, perception, or behavior. Dissociation is the mind's way of protecting itself from overwhelming stress or trauma. While mind dissociation can occur in everyday life, dissociative disorders involve severe, persistent, and distressing dissociation that interferes with daily functioning. These disorders are most commonly associated with traumatic experiences, especially those occurring in childhood. Dissociative amnesia is a disorder in which a person is unable to recall important personal information, usually related to a traumatic or stressful event. This memory loss cannot be explained by brain injury, substance use, or ordinary forgetting. Instead, it occurs because the mind blocks painful memories as a psychological defense. The forgotten memories are typically autobiographical and emotionally distressing in nature. Categories of dissociative amnesia. First one, localized amnesia. Refers to the inability to recall events that occurred during a specific period of time, usually surrounding a traumatic experience. For example, a person may be unable to remember anything that happened during the hours or days following a serious accident or assault. Second, selective amnesia. Selective amnesia occurs when a person can recall some parts of a traumatic event but not others. Less distressing details may be remembered, while the most painful or threatening aspects are blocked from awareness. For instance, a person may remember being present at the scene of an event but not remember the actual trauma itself. Generalized amnesia. It involves a complete loss of memory for one's life history. The individual may forget their name, identity, family members, occupation, and past experiences. This form is rare and usually associated with extremely severe psychological stress or trauma. Systematic amnesia. Systematic amnesia refers to the loss of memory for a specific category of information. This may include forgetting all memories related to a particular person, place, or type of experience. For example, a person may forget everything related to a specific relationship or period of abuse. Dissociative fugue. Dissociative fugue is a subtype of amnesia categorized by sudden and unexpected travel away from home or work. During a fugue state, the person may be confused about their identity or may assume a new identity altogether. They may appear normal to others but have no awareness of their past life. When the fugue episode ends, the individual is unable to recall what happened during that period. Dissociative fugue usually occurs after severe stress or trauma and represents an extreme form of psychological escape. Dissociative identity disorder (DID) involves the presence of two or more distinct identities or personality states within a single individual. Each identity may have its own name, age, memories, emotions, behavior, patterns, and ways of interacting with the world. There are significant gaps in memory for everyday events, personal information, or traumatic experiences. When one identity takes control, the others may have no awareness of what is happening. DID is strongly linked to chronic and repeated childhood trauma, particularly physical, emotional, or sexual abuse. It is not acting or pretending. Rather, it is a complex survival mechanism in which the mind fragments identity to cope with overwhelming trauma. Depersonalization or derealization disorder involves persistent or recurrent experiences of detachment from oneself, the external world, or both. Depersonalization refers to feeling disconnected from one's own body, thoughts, or emotions as if observing oneself from outside. Derealization refers to experiencing the surrounding world as unreal, distant, foggy, or dreamlike. Despite these experiences, reality testing remains intact. The person knows that these sensations are not real. Mood disorders affect how individuals feel, think, behave, and function in daily life. These are not normal mood fluctuations, they are intense, long-lasting, and often interfere with personal, social, academic, and occupational functioning. Mood disturbances may involve extreme sadness, emptiness, hopelessness, or abnormally elevated and irritable mood. Major types of mood disorders. Mood disorders are broadly divided into depressive disorders and bipolar related disorders. Let us understand each major condition in detail. Depression. Major depressive disorder. Depression is one of the most common and serious mood disorders. It is characterized by a persistent low mood and a marked loss of interest or pleasure in activities that were once enjoyable. Common symptoms of depression include persistent sadness or emptiness, fatigue, sleep disturbances, changes in appetite or weight, difficulty concentrating, feelings of worthlessness or excessive guilt, hopelessness, and recurrent thoughts of death or suicide. These symptoms last for at least 2 weeks and significantly impair daily functioning. Depression affects not only emotions but also physical health, motivation, thinking patterns, and decision making. Postpartum depression. Postpartum depression is a mood disorder that occurs after childbirth. While mild mood changes or baby blues are common, postpartum depression is more severe and long-lasting. Symptoms may include intense sadness, crying spells, emotional numbness, anxiety, irritability, feelings of inadequacy as a parent, difficulty bonding with the baby, and withdrawal from family or social support. Postpartum depression is caused by a combination of hormonal changes, emotional stress, physical exhaustion, and psychological factors. It is a serious condition that requires understanding, support, and professional help. Seasonal affective disorder (SAD). It is a type of depression that occurs at a specific time of the year, most commonly during autumn and winter. It is associated with reduced sunlight exposure, which affects biological rhythms and mood-regulating chemicals in the brain. Symptoms include low energy, excessive sleep, increased appetite, weight gain, difficulty concentrating, and feelings of sadness or hopelessness. Symptoms usually improve during spring and summer months. SAD highlights the strong link between environment, biological rhythms, and mood. Mania. Mania is a state of abnormally elevated, expansive, or irritable mood accompanied by increased energy and activity levels. Symptoms of mania include excessive happiness or irritability, reduced need for sleep, rapid speech, racing thoughts, inflated self-esteem, impulsive behavior, poor judgment, and increased goal-directed activity. During manic episodes, individuals may engage in risky behaviors without considering consequences. Mania is not simply feeling happy, it represents a serious disruption in emotional regulation and judgment. Bipolar mood disorder. Bipolar mood disorder is categorized by alternating episodes of depression and mania or hypomania. Depressive episodes resemble major depression, involving sadness, hopelessness, fatigue, and loss of interest. Manic or hypomanic episodes involve elevated mood, increased energy, reduced need for sleep, impulsivity, and impaired judgment. These mood swings are intense and unpredictable, often disrupting relationships, work, academic performance, and daily functioning. Bipolar disorder is a lifelong condition that can be managed effectively with proper treatment and support. Suicide. Understanding the risk. Suicide refers to the act of intentionally causing one's own death and is often associated with severe mood disorders, particularly depression and bipolar disorder. Suicidal thoughts usually arise from the overwhelming emotional pain, feelings of hopelessness, helplessness, and the belief that suffering will never end. It is important to understand that suicidal thoughts are a sign of intense psychological distress, not a desire for death itself. Most individuals who experience suicidal thoughts want relief from pain, not an end to life. Warning signs of suicide. Common warning signs include talking about death or hopelessness, withdrawing from others, drastic mood changes, loss of interest in life, giving away possessions, increased substance use, and expressions of feeling like burden. Prevention of suicide. Suicide is preventable. Prevention includes early identification of mood disorders, timely psychological intervention, access to mental health care, supportive relationships, and reducing stigma around mental illness. Listening without judgment, offering emotional support, encouraging professional help, and ensuring safety during crisis situations are crucial steps in prevention. Education, awareness, and compassion play a vital role in saving lives. Mood disorders deeply influence emotions, thoughts, behaviors, and overall quality of life. From depression and seasonal mood changes to manic episodes and bipolar disorder, these conditions remind us that mental health deserves the same care and attention as physical health. Understanding mood disorders and promoting suicide prevention are essential steps towards building a mentally healthier and more compassionate society. Students, this is part 3 of your syllabus. Watch part 4 for the remaining psychological disorders.